Bowel cancer is the third most common cancer that we see and the second most common cause of cancer death in the UK. Your risk goes up dramatically after the age of 40, and in fact 80% of the cases that we diagnose are in patients over the age of 60. The lifetime risk of developing bowel cancer in men is 1 in 18 and in women 1 in 20. About 100 new cases of bowel cancer are diagnosed per day in the UK, so it's extremely common. And that means that the average GP is likely to see about 1 case every 10 months and would need to refer 30 to 40 cases per year to pick up that 1 case of bowel cancer. Internationally, the mortality and 5-year survival for bowel cancer has dramatically improved over the past 20 years. That's largely the result of better treatments and earlier diagnosis, but there is still clearly scope for more improvements. However, mortality in the UK is higher than our international counterparts. The excess mortality that we see occurs in the first 3 months from diagnosis and therefore reflects late diagnosis. One solution to this is bowel screening. The NHS bowel cancer screening programme, which has now been rolled out nationally, should influence the epidemiology of the disease, diagnosing more patients earlier and at an earlier stage of the disease. It's estimated that if at least 60% of people who are invited attended, we could reduce the number of bowel cancer cases by 20,000 new cases over a 20-year period. So in terms of bowel cancer screening, the NHS offers 2 types of bowel cancer screening for adults registered with a GP in England. The first is the National Bowel Cancer Screening Programme, where all men and women aged 60 to 74 are invited to carry out a fecal occult blood test. Every 2 years they're sent a home test kit where you have to poo on a stick and send back 3 separate stool samples. The current fecal occult blood test is a guaiac-based test whereby the presence of heme in the stool is used as a catalyst which turns the test paper blue. Perhaps a better test might be the fecal immunochemical test, which utilises a single stool sample and may be more sensitive in diagnosing bowel cancer. Discussions are underway whether the National Bowel Cancer Screening Programme should itself adopt this new test. The second screening programme is called Bowelscope. This offers everybody a single one-off flexible sigmoidoscopy at around their 55th birthday. It's currently being piloted in England, and whether it is rolled out nationally remains to be seen. Engaging in the bowel cancer screening programmes is shown to reduce your mortality of bowel cancer by up to 16%, and removing the adenomatous polyps that we find also prevents bowel cancer. However, screening must be weighed up in terms of its benefits and its risks, and any potential harm should be discussed with all patients before enrolling. However, all screening programmes potentially involve some degree of harm, so you have to, as a GP and a patient, weigh up whether you're going to participate. We would obviously encourage everybody to participate in bowel cancer screening. The variability across the country for participation is between 40 and 50%, and really we want to be aiming for about 60%. Finally, a word of caution that GPs shouldn't rely heavily on a negative fecal occult blood test. There is a false negative rate, and there is also interval cancers that develop between 2 screening colonoscopies. So although it's the best we have at the moment and it's really very effective, if GPs are concerned about patients or if patients develop symptoms, they should be investigated in their own right, whether or not they've had a recent negative fecal occult blood test.